So, and these are my drains. I'm going to get them taken out tomorrow. So I've had them in for a week and a day tomorrow. Although I'm not sure, they might have put a different drain in on this side, the side that I had the hematoma on. So anyway, so I'll just show you what everything looks like. I'm going to put my glasses on because I can't see really well without them, but there's glare, so you know. All right. Anyway, so yeah, first I should take these off and just attach them to something else. And I haven't had much pain actually. It's been really, really amazing. Um, I was taking Percocet, but a couple of days ago, what was that, Friday? I think I took my last Percocet, so I've been just taking just regular extra strength Tylenol, 2 every 6 hours. Um, yeah, you can see how annoying this thing can be. It's even worse putting it on, you can imagine. Alright. Okay, so there we go. Alright, and this is basically an ACE bandage wrap. They gave me this the surgery center just to keep everything compressed. I know that you shouldn't bind with this when you actually have breast that you're trying to bind, but this is just to keep the area compressed so that the tissues meld together basically, and I don't have any seroma formation, which is like a collection of fluid between the layers of skin. So this isn't me binding like I was before. This is just like a surgical binding to make sure that everything is compressed and stays in place. So anyway, take this off. And I mean, I wrap it relatively tight, just so it feels snug. And this one's really nice because it actually has Velcro on on both ends, so you don't have to use those clips. Okay, so I don't know if you can see this on here, but my drains, well, this is just some fluffy stuff that I put on here so they don't rub against my skin so much, because that's kind of painful. The drains are like the most painful part actually, if they get like tugged on. It's kind of like, feels like a hard pinch, I guess. I don't know how else to describe it. I mean, it's not like super painful. It's just like, ew, ouch, you know. Anyway, and it's common to have some leakage like around the drain insertion site. That looks a lot more painful than it actually is. um, so, all right. So anyway, so I've got my drains. So they go. Well, this is where they come out, I guess, and then they're attached to these these bulbs or grenades, basically, and it collects fluid. So this is all I've collected today because it's been a week since I've had this one, and they kind of stopped collecting stuff after a while. There's not much to collect. And I don't know if you can tell, but it's clear over here, and there's red stuff here. There's fluid. So what you have to do is strip the tube or milk it, and this is best done actually with like a cotton ball soaked in some alcohol, but I mean, you can do it just with your fingers. So you have to like press down, press down with one finger, and with the other one you press down and you just move it. Yeah, and it just moves all that fluid down into this uh, storage container. and it's under suction, so most of it just goes right down in there. But they suggest that you you strip them twice before you measure um, how much fluid you've collected, just to make sure that you've gotten as much as you can out of them, out of the tubes. So, yep, there's that. And here's the other one. And also, not only do you collect less fluid as the days go by, but also it changes color, or it's supposed to. So this one is still more reddish, and this one is a lot lighter. It's actually more like an orangish or light yellowish, and it's a lot more watery too and translucent. This one looks more like, I don't know, like watered down fruit juice or something, like watered down tomato juice, really watered down tomato juice. And initially it looked like, uh, I don't know, it looked more like, it was actually kind of purple in color. It was kind of interesting, and it seemed thicker. Like it wasn't like ketchup thick. It was just like fruit juice thick, unwatered down fruit juice thick. So anyway, so this stuff is like hardly anything in here. Um, so this side basically has taken an extra. It's basically a day behind because it had to be operated on again. So yes, I'll go ahead and just remove this one. And when you do this, you want to like try not to pull on it there because that's where it hurts. So you can keep that as still as possible. That's the best thing. Sorry, this is kind of boring, but I figured I should go ahead and do this while I'm here doing it. Right. So, yes, there we go, and I'll finish that later. And so what I'll do is I'll uncap this and pour it into a little like measuring cup, like the kind that you take like I don't know Dayquil in or whatever. They give you these. It's not like I'm using the one that I take Dayquil and that would be really gross. Anyway, and then you measure how much you have in milliliters or cc's. And once you have, um, and you should do it at least twice a day. It depends on how fast they fill up. You don't want them to fill up more than half because then their suction is not as efficient, and you want as efficient suction as possible so that the healing goes as fast as possible. And these are, by the way, these are called Jackson Pratt drains or JP drains or just drains. Um, and they've got this little like thing up here, like on a volleyball. You know how you unplug it and then you blow air into it, or you unplug it and all the air comes out. It's kind of the same thing, except you're not blowing air into it. Again, that would be really painful, but never mind. Anyway, so what you want to do is once you've stripped the tubes twice, or however many times your doctor tells you to, then you just take this cap off and you pour the fluid you have in here in a little measuring cup, and you measure how much you have and you write it down. And you want to do that at least twice a day, or like I said, whenever it gets about half full, or whenever you think that you should do it. I mean, it's kind of up to your personal discretion. But I mean, if it had less than this amount in it, I mean, there's always going to be a little bit left. So yeah, if it has less than this in it, I wouldn't even bother because you're not even going to get anything that you can measure. um, let's see, and you measure them separately. So, and then usually once you're down to 10 cc's or less a day, then that means that your drains are ready to come out, and mine are about that. Definitely this one. Another interesting thing is these drains. So they go in here, and mine, I don't know if you can, well, oh, look, you can see that, right? So that's where the drain is. It goes all the way around. On this side too. Although I don't, wait, did you see that? I could kind of see that. There's that contour there. So that's really weird. This because the drains are actually like under your skin and all the way around, and then back down. I don't know exactly where they end because I'm really numb like right here, but yeah, feeling them is really odd because it's numb up here too. But yeah, anyway, so um, and I just have these Johnson and Johnson non-stick pads covering my nipples, and I've been putting Bactroban on them, prescription strength. My doctor prescribed that to me just to make sure that they didn't get infected. So I'll show you what they look like. And they are like a dark purple, like black right now. They're still healing. Like I said, I've only had the surgery a week ago. So, yeah. And there's also these, I'm not sure exactly what these are, but there's some, like, this blue thread that, like, goes, like, through them and underneath. And I don't know what exactly the deal with that is. And I've got this, like, surgical tape here. And I mean, I've showered at least once a day, and since Friday, twice a day, um, using like Dial antibacterial soap because that's what they told me to do. Um, and I mean, this stuff doesn't come off, and it's not like I'm trying to peel it off either, but still, it's like stuck there. Um, and so yeah, I've got a lot more bruising on this side. This was the side that I had the hematoma on, and let's see. So that's it's a little bit difficult to stand up straight because of how I've got these drain tubes situated. Okay, so yeah, there we go. Um, mhm. And I'm still regaining full motion with my arms. Like this side is still like healing like a day slower than the other side. And I'm not as constipated as I used to be. That was actually a really annoying part of having the surgery, or having any surgery, is that when you go under general anesthesia, your metabolism slows down. Well, your digestive system slows down, so you can't poop. And yeah, basically, yeah, that was bad. So yeah, I'm just now getting over that, and things are going back to normal. So yeah, and anyway, and let's see. I don't know how well you can see this, but I still have some swelling, like mm, like there's still swelling around here, like this area. Like it's not completely flat, but I think the swelling will continue to go down. And yep. So there we go. And it's obviously still red, um, and bruised, and it's itchy. Like actually, like right here on my sternum is like really itchy spot. Um, so the nerves are starting to like the itchiness is one indication that it's healing and that the nerves are reconnecting and feeling things again. So that's great, but you probably shouldn't scratch. I mean, and when I actually shower, like I can't actually feel anything on my nipples, so those are completely numb. But yeah, yeah. So this is me 1 week, uh, one week after surgery, and 6 days after my aspiration of the hematoma on this side. Um, all right, I'm going to go redress everything now because I don't want stuff to dry out. Alrighty.